Feeling like your body isn't quite responding the way it used to? Maybe things just aren't as reliable as they once were in the bedroom department. It's a topic nobody really wants to talk about, is it? That sense of frustration, maybe a little embarrassment, wondering why this is happening now. You might be trying everything you can think of, maybe eating healthier, exercising more, reducing stress, but still, something feels off. It feels like there's a hidden barrier, something you can't quite put your finger on, sabotaging your confidence and intimacy. The truth is, sometimes, the very things you're doing to stay healthy in other ways, like taking necessary medications for important conditions, could unintentionally be causing these problems. It's a painful reality to consider, isn't it? That the pill you take diligently every morning could be working against your sexual health without you ever realizing it. It's not something doctors always bring up, unless you ask, and frankly, many people don't know to ask. But understanding this connection is the first step towards finding a solution. It's empowering to know what's really going on. In this video, we're going to pull back the curtain on 5 common types of medications that might be quietly contributing to issues like erectile dysfunction, often without you even suspecting them. We're not just going to list them. We'll talk about why they might affect things and what you can do about it, because there are always options to explore with your doctor. Stick with me, because what's coming next might just surprise you and offer a new perspective on regaining your sexual vitality. Let's dive right into the first area where medications can play a surprising role, and that's with medications used to manage your heart health. Specifically, certain medications for high blood pressure. High blood pressure, or hypertension, is incredibly common, especially as we get older, and taking medication for it is vital for preventing serious issues like heart attack and stroke. Millions of people rely on these medications every day. But did you know that some of these workhorse drugs, while doing a great job of protecting your heart, can sometimes interfere with the very delicate process required for an erection? Think about how an erection works. It's all about blood flow. For an erection to happen, blood vessels in the penis need to relax and open up, allowing blood to rush in and fill the spongy tissues. This relaxation process is controlled by signals from your nerves and chemicals in your body, particularly one called nitric oxide. Anything that interferes with these signals, or the ability of blood vessels to relax, can make getting or keeping an erection difficult. Now, certain types of blood pressure medications can impact this process. Let's talk about beta blockers first. These medications work by blocking the effects of adrenaline and other stress hormones on the heart and blood vessels. This slows down your heart rate and reduces the force with which your heart pumps blood, which lowers blood pressure. They also affect blood vessels, sometimes causing them to constrict a little, because erections rely on blood vessels expanding to allow blood in. A medication that causes even slight constriction can potentially hinder the process. Beta blockers can also sometimes affect the signals involved in arousal and nerve function. It's not guaranteed, and many people take beta blockers without any sexual side effects. But for some, they can definitely be a culprit. It's a bit of a cruel irony. You're taking a medication to protect your heart so you can live a long, healthy life, hopefully including intimacy. But the medication itself might be putting a damper on things in the bedroom. Another class of blood pressure medications that can sometimes cause issues are diuretics, often called water pills. These work by helping your body get rid of excess salt and water, which reduces the volume of blood in your system and thus lowers blood pressure. However, by reducing overall blood volume, they can sometimes make it harder for enough blood to flow into the penis to create a firm erection. They can also affect nerve signals and potentially lower zinc levels in the body, which some research suggests could play a minor role in sexual function. Again, this isn't a universal side effect. but it happens often enough that it's worth being aware of. It's important to understand that these medications are often critical for your health. You absolutely should not stop taking your blood pressure medication just because you're experiencing erectile issues. That could be far more dangerous than the ED itself. The key here is awareness and communication. If you started experiencing erectile difficulties after starting a new blood pressure medication or changing the dose of an existing one, it's a big clue that the medication might be involved. What can you do? This is where talking to your doctor is essential. They need to know what's happening. Don't be shy or embarrassed. This is a common issue. Tell them specifically when the problem started and what medications you are taking. A good doctor will listen and work with you. They might consider switching you to a different type of blood pressure medication. There are many classes of blood pressure drugs, like ACE inhibitors, ARBs, angiotensin II receptor blockers, or calcium channel blockers, which are less likely to cause erectile side effects. Sometimes, adjusting the dose might help. Or they might suggest adding a medication specifically for erectile dysfunction, like sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra, or avanafil, Stendra, which can often be taken safely alongside your blood pressure medication. Though it's crucial, your doctor advises on this, especially with certain heart conditions or blood pressure levels. Lifestyle changes can also play a huge role here. Improving overall cardiovascular health through diet, exercise, losing weight if necessary, and quitting smoking can improve blood flow throughout the body, including to the penis. These changes can sometimes reduce the need for certain doses or types of medication over time, or simply improve your body's ability to achieve an erection, even while on medication. So, while the medication might be a factor, addressing your overall health picture is always beneficial. The conversation with your doctor might sound like, "Doctor, I've noticed I've been having trouble with erections since I started this blood pressure pill. Is it possible the medication could be contributing, and are there any other options we could consider?" Be open, be honest, and advocate for yourself. Your doctor is your partner in managing both your heart health and your quality of life. Recognizing that a vital medication could have this impact is the first step in addressing it, rather than just suffering in silence or thinking it's just age. Now, moving on from the heart to the head, let's talk about medications that affect your mood and mental state, because they are another common, often overlooked, contributor to sexual issues. Okay, moving on from heart medications, let's delve into another very common class of drugs, especially for those navigating later life challenges, or simply dealing with the everyday stresses that can accumulate. Antidepressants and medications for anxiety. It's no secret that mental health is just as important as physical health, and these medications can be life changers, helping people manage depression, anxiety, obsessive-compulsive disorder, and other conditions. They improve mood, reduce worry, and allow people to function better day to day. However, just like blood pressure medications, they can have unintended consequences on sexual function. And for many people, this is a significant side effect that they weren't fully prepared for or aware could be linked to their medication. The connection here is a bit different than with blood flow. Many common antidepressants, particularly the group called selective serotonin reuptake inhibitors, or SSRIs, work by affecting chemical messengers in the brain, primarily serotonin. Serotonin plays a crucial role in regulating mood, but it also influences other bodily functions, including sexual arousal, desire, and the ability to reach orgasm. By increasing serotonin levels in the brain, SSRIs can sometimes dampen libido, sexual desire, make it harder to become aroused, delay or prevent orgasm. This is a very common side effect with SSRIs, sometimes called delayed ejaculation, and yes, can also contribute to difficulties getting or maintaining an erection. It's not just SSRIs. Other types of antidepressants, like SNRIs, serotonin and norepinephrine reuptake inhibitors, and even some older types of antidepressants, can have similar effects. Medications used primarily for anxiety, particularly benzodiazepines like Valium or Xanax, can also affect sexual function, though often the mechanism is related to their sedating effects or their impact on the nervous system rather than directly on serotonin. They can reduce libido and make it harder to achieve arousal or orgasm. The impact of these medications on sexual function is highly variable from person to person. Some people experience no issues at all, while for others, the side effects can be quite distressing and significantly impact their quality of life and relationships. The cruel irony here is that while the medication is helping lift your mood or reduce anxiety, the resulting sexual side effects can unfortunately create new sources of stress, frustration, and feelings of inadequacy. This is another area where many people suffer in silence, perhaps feeling too embarrassed to bring it up with their doctor, or assuming that these side effects are just something they have to live with because their mental health condition requires medication. Again, and I cannot stress this enough, you must never stop taking your antidepressant or anti-anxiety medication suddenly without consulting your doctor. These medications need to be tapered off slowly under medical supervision to avoid potentially severe withdrawal symptoms and the return of the underlying condition. Your mental health is paramount, and the goal is to find a way to manage both your mental health and your sexual health effectively. So, what are the steps you can take if you suspect your antidepressant or anxiety medication is affecting your erections or overall sexual function? The first and most important step is, again, to talk openly with your doctor or psychiatrist. They are the experts who can help you navigate this. Be specific about your symptoms. Has your desire decreased? Are you having trouble getting or keeping an erection? Is it harder or impossible to reach orgasm? Tell them when these symptoms started relative to when you started or changed your medication dose. Your doctor has several potential strategies they might discuss with you. One option is to try switching to a different antidepressant or anti-anxiety medication. Some antidepressants, such as bupropion, Wellbutrin, are known to have a lower incidence of sexual side effects compared to SSRIs, and might even improve libido in some people. Others, like mirtazapine, Remeron, also tend to be less problematic sexually. It's not a one-size-fits-all situation. Your doctor will consider your specific mental health needs and other medications you're taking when suggesting an alternative. Another approach your doctor might consider is adjusting the timing of your dose. Sometimes taking the medication at a different time of day can help, though this is less commonly effective for sexual side effects compared to other side effects. For some people, particularly those experiencing difficulty with orgasm, their doctor might suggest a drug holiday, where they temporarily skip their dose on days they plan to have sex. This is something only to do under strict medical guidance, as it's not suitable for everyone or every medication and can be risky. For those whose primary issue is erectile dysfunction, while on one of these medications, adding a medication specifically for ED, like Viagra or Cialis, is often a very effective strategy. These medications work by improving blood flow to the penis and are generally safe to take with most antidepressants. Though again, this needs to be confirmed by your doctor based on your overall health profile. Lifestyle factors continue to be important here too. Managing stress through techniques like mindfulness, meditation, or therapy can support both mental health and potentially reduce reliance on higher doses of medication over time. Regular exercise and a healthy diet improve overall well-being and blood flow. Sometimes, the underlying depression or anxiety itself, before medication even comes into play, can cause sexual problems. So, treating the mental health condition is crucial. But finding the right treatment that minimizes unwanted sexual side effects is key to a better quality of life all around. Don't feel guilty or like you're being demanding by bringing this up. Sexual health is a vital part of overall well-being, especially as we age, and you deserve to have a fulfilling life in all aspects. Now, let's move on to another surprising group of medications that might be causing issues below the belt, and these are commonly found in your medicine cabinet for everyday ailments. Let's move on to a category of medications that you might not even think of as impacting something like erections, because they're often taken for temporary issues or common allergies. Antihistamines. You know, the medications people take for hay fever, hives, or sometimes even as a sleep aid, because they can cause drowsiness. While newer generation antihistamines tend to have fewer side effects, many people still use older, over-the-counter versions, or are prescribed them for various conditions. These older antihistamines like diphenhydramine, found in Benadryl, or chlorpheniramine, primarily work by blocking the effects of histamine, a chemical involved in allergic reactions. However, they also have what's called anticholinergic effects. Anticholinergic effects mean they block the action of another important chemical messenger in the body called acetylcholine. Acetylcholine is involved in many processes, including nerve signal transmission, muscle contraction, digestion, and crucially, it plays a role in the cascade of nerve signals that lead to sexual arousal and ultimately erection. By blocking acetylcholine, these older antihistamines can interfere with these nerve signals. This can lead to reduced sensation, difficulty achieving arousal, and can make it harder for the penis to receive the proper nerve signals needed to initiate and sustain an erection. They can also cause dryness, which can affect overall sexual comfort and experience, though this is less directly related to erection firmness. Furthermore, the sedating effect of these older antihistamines can simply lower overall energy levels and desire. If you're feeling drowsy and foggy from your allergy medication, intimacy might be the last thing on your mind, regardless of your physical ability to get an erection. It's a combination of direct physiological effects on nerve signaling and indirect effects on energy and libido. Just like with the other medications we've discussed, the impact varies. Some people take older antihistamines without any noticeable sexual side effects, while others find they experience reduced desire, difficulty with erection, or problems with orgasm. Because these medications are often used on an as-needed basis for allergies or colds, people might not connect the occasional difficulty with their erection to the pill they took the day before or the night before. The timing might not always align perfectly in their mind, making it a subtle, often overlooked factor. If you frequently use older, sedating antihistamines and are experiencing difficulties with erections, it's worth considering if there's a connection. This is particularly relevant if your symptoms seem to be worse when you're taking these medications, or during allergy season when your usage might be higher. Again, the course of action is to discuss this with a healthcare professional. Explain which antihistamines you use and how often. They might suggest switching to a newer generation, non-sedating antihistamine, such as loratadine, Claritin, cetirizine, Zyrtec, or fexofenadine, Allegra. These medications are much less likely to have anticholinergic effects or cause significant drowsiness, thus minimizing their potential impact on sexual function. For some people, managing allergies through other means, like nasal sprays or allergy shots, might be an option that reduces the need for oral antihistamines altogether. Sometimes people take these older antihistamines not for allergies, but specifically as a sleep aid because of their sedating effect. If this is the case, discuss your sleep difficulties with your doctor. There might be other, more appropriate ways to address insomnia that don't carry the same potential sexual side effects. This could involve exploring sleep hygiene techniques, behavioral therapy for insomnia, CBTI, or considering other sleep medications that have a different side effect profile. It's about finding the right tool for the job that doesn't inadvertently sabotage other aspects of your health and well-being. Now let's shift gears slightly and talk about medications commonly used by men specifically, often related to prostate health or even hair loss, as these can also unexpectedly affect erections. One significant group is medications for benign prostatic hyperplasia, BPH, which is the non-cancerous enlargement of the prostate gland, a very common condition in older men that causes bothersome urinary symptoms. Two main types of medications are used for BPH symptoms: alpha blockers and 5-alpha reductase inhibitors. Alpha blockers such as tamsulosin, Flomax, alfuzosin, uroxatrol, silodosin, Rapaflo, and others work by relaxing the muscles in the prostate and bladder neck, making it easier to urinate. While generally well tolerated, they can sometimes affect ejaculation, leading to a decrease in the amount of semen released or even retrograde ejaculation, where semen goes backward into the bladder. Less commonly, some alpha blockers can also slightly affect blood vessels and nerve signals, potentially impacting erections, though this is less frequent than ejaculation issues. 5-alpha reductase inhibitors, such as finasteride, Proscar, Propecia, and dutasteride, Avodart, work differently. They shrink the prostate gland over time by blocking the conversion of testosterone to dihydrotestosterone, DHT, a hormone that stimulates prostate growth. Finasteride at a lower dose is also used for male pattern baldness, Propecia. Because these medications directly affect hormone levels, they are well known to have potential sexual side effects. They can decrease libido, make it harder to get or keep an erection, and cause difficulties with ejaculation. For a subset of men, these side effects can be persistent even after stopping the medication, a condition sometimes referred to as post-finasteride syndrome, although this is a complex and debated topic in the medical community. If you are taking medication for BPH or finasteride for hair loss and experiencing sexual side effects, it's incredibly important to talk to your urologist or the doctor who prescribed these medications. They are very familiar with these potential issues. For alpha blockers, sometimes switching to a different alpha blocker might help, or your doctor might consider combination therapy if your symptoms are severe. For 5-alpha reductase inhibitors, the decision is more complex. If the side effects are bothersome, your doctor might discuss stopping the medication or trying an alternative BPH treatment like surgery or other medications that don't affect hormones, though these have their own side effects to consider. If you are taking finasteride for hair loss, weighing the benefit of hair retention against the impact on sexual function is a personal decision to discuss with your doctor. It's also worth noting that BPH itself, even without medication, can sometimes be associated with erectile dysfunction. Factors like age, underlying cardiovascular issues, which often coexist with BPH, and the stress of dealing with bothersome urinary symptoms can all contribute to sexual difficulties. So, sometimes treating the BPH effectively might indirectly improve sexual function, even if the medication carries a small risk of side effects. This highlights the interconnectedness of these issues and the need for a comprehensive discussion with your doctor about all your symptoms and concerns. Don't assume that urinary problems and erectile problems are totally separate. They often share common underlying causes and can influence each other. Addressing one might help the other, or treating one might impact the other, so keeping your doctor informed about everything is crucial. Now, we're heading into the final points and some important overall takeaways. Finally, let's look at a class of medications often used for pain relief, particularly stronger pain relievers or those used for nerve pain, and sometimes even medications for conditions like heartburn. While the link might not be as direct or common as with blood pressure or antidepressants, certain medications in these categories can also potentially impact sexual function, including erections, and are worth being aware of, especially if you are taking them regularly. Opioid pain medications, often prescribed for moderate to severe chronic pain, are one such group. While not everyone taking opioids experiences sexual side effects, they are a known possibility, particularly with long-term use. Opioids can affect hormone levels, including lowering testosterone, which is a key hormone involved in male sexual desire and function. Low testosterone can lead to reduced libido and contribute to erectile difficulties. Additionally, opioids can have a general sedating effect and impact nerve signaling, both of which can negatively affect sexual arousal and performance. If you are managing chronic pain with opioids and notice a decline in sexual function, it is absolutely something to discuss with your pain specialist or prescribing doctor. Managing pain effectively is important, but so is your quality of life, which includes sexual health. Your doctor might explore options for pain management that rely less on opioids, or strategies to mitigate the hormonal effects if opioids are necessary. Another group sometimes linked, though less directly, are certain medications used for nerve pain or seizures, like gabapentin or pregabalin. While primarily affecting nerve signals to reduce pain or control seizures, they can also sometimes have side effects that impact libido and sexual function in a subset of patients. The mechanisms are not fully understood, but again, involve effects on the nervous system. If you take one of these medications and experience sexual difficulties, it's a side effect worth mentioning to your doctor to see if alternatives or adjustments are possible. Even some medications for heartburn or acid reflux, specifically a type called H2 blockers, like cimetidine, also known as Tagamet, have been linked to potential sexual side effects, including erectile dysfunction and decreased libido, though this is less common with newer, more frequently used acid-reducing medications, like proton pump inhibitors, PPIs. Cimetidine, in particular, has been shown to have anti-androgenic effects, meaning it can weakly block the effects of male hormones when used at high doses or for prolonged periods, which could potentially impact sexual function. If you're taking older heartburn medications regularly and experiencing issues, it might be worth discussing if a different medication or approach to managing your symptoms could be better. So, as we've seen, from medications for your heart and mind to those for common ailments and specific male health issues, many different types of pills, taken for important reasons, can potentially have an unwanted impact on erections and overall sexual function. The crucial takeaway from all of this isn't to become fearful of necessary medications, but to become informed and empowered. These medications are often essential for managing serious health conditions that allow you to live a longer, healthier life. The goal is not to choose between your health and your sexual function, but to find a way for them to coexist as harmoniously as possible. Think back to the 5 categories we touched upon: certain blood pressure medications, antidepressants, and anxiety medications, older antihistamines, prostate medications, and some pain or nerve medications, even some older heartburn medications. The common thread is that while they're treating one condition, their effects on blood flow, nerve signals, or hormones can sometimes create challenges for sexual performance. The single most important message I can leave you with is this: talk to your doctor. Don't assume that erectile dysfunction is just an inevitable part of aging that you have to accept. It's true that age is a factor, but it's very often influenced or directly caused by treatable factors, including your medications. Your doctor needs to have the full picture of what's going on with your health, and that includes your sexual health. Be open, be honest, and don't be embarrassed. Doctors discuss these issues every single day. When you talk to your doctor, be prepared to list all the medications you are taking, including prescription drugs, over-the-counter medications, supplements, and herbal remedies, as interactions between these can also sometimes cause problems. Tell them when your sexual symptoms started and how they relate to when you began taking certain medications or changed doses. This information is incredibly valuable for them in figuring out the potential cause. Remember, there are almost always options. It might be switching to a different medication in the same class that's less likely to cause sexual side effects, adjusting the dose, adding a medication specifically for ED, or exploring alternative treatments for the original condition. Lifestyle changes, like improving diet, increasing physical activity, managing stress, ensuring adequate sleep, and quitting smoking, can also significantly improve blood flow and overall health, which benefits both your underlying condition and your sexual function, potentially even making medications work better or reducing the need for them over time. Feeling vital and maintaining intimacy is a really important part of a fulfilling life at any age. Don't let treatable issues like medication side effects steal that from you. Be proactive, have that conversation with your doctor, and explore the options available to you. There is so much that can be done to improve things. You have the power to take control of this aspect of your health and well-being. If you found this information helpful, if it sparked some thoughts or gave you questions to ask your own doctor, please let me know in the comments below. Sharing your experiences can also help others who might be going through something similar. And if you want to learn more about aging well, maintaining your health, and living your best life at every age, make sure to give this video a thumbs up and subscribe to the channel. We cover all sorts of topics to help you stay informed and empowered about your health journey. Remember, small changes and open conversations can make a big difference. Live your best life at every age.